The broadcast is now starting. All attendees are in listen-only mode.
I'd like to welcome Trudy Mulder Hall, who is an RN working in the role of clinical nurse specialist, advanced practice nurse, and palliative care for the past several years at Central West CCAC. Previously, she has been a palliative case manager and community intake case manager, both in Central West and Simcoe County. She also has experience in acute care settings, including cardiovascular, orthopedic, and ICU nursing. She also has been a faculty advisor with a university nursing program. Trudy is a certified Canadian hospice palliative care nurse. She is the Central West Lynn area representative with the Hospice Palliative Care Association Community Practice Leads on advanced care planning and healthcare consent to promote consistent messaging and the importance of following the law around the issue in Ontario. In her role at CCAC, she provides support to patients, families, nurses, physicians, and other healthcare providers, optimizing hospice palliative care support through capacity building, education, research, and symptom management. Trudy is also working on a project through Health Quality Ontario on early identification of patients who can benefit from a palliative care approach to care. And also Jehanera, who is an advanced practice nurse with Central West CCAC. She has a Master of Science in Nursing from McMaster University and is a certified hospice palliative care nurse. Prior to this, Jehanera has worked with Central West CCAC as care coordinator for a number of years. Jehanera is also an instructor with the Centennial George Brown Ryerson University Collaborative BSCN program. In her current role as an advanced practice nurse at CCAC, she provides support to patients, families, nurses, physicians, and other healthcare providers in optimizing hospice palliative care through capacity building, education, research, and symptom management. Thank you for being here today.
Thank you, Angela. So we will be speaking today on the healthcare consent and advanced care planning in Ontario and what you need to know.
So as Angela mentioned our names to you guys, it's me, Jehanara, and Trudy with me here. We just want to declare we don't have any relationships with commercial interest. Also, at the same time, I want to thank Hospice Palliative Care Practice Community to let us use their slides and their resources to present this webinar. So let's start with a knowledge test and see how much we know and how much more we need to know. So, what is the name of the law that governs advanced care planning in Ontario? The Coroner Act, the Living Will Act, the Advanced Care Planning Act, the Healthcare Consent Act, the Substitute Decision Makers Act, the Power of Attorney Act. What do you think, Trudy?
In Ontario, it's called the Healthcare Consent Act.
Good.
So Jehanera, what is the correct term used with the laws related to advanced care planning in Ontario? Advanced Directive, Living Will, Advanced Care Plan, Expressing Wishes, Goals of Care, all of the above, or none of the above?
It's expressing wishes. What are the 4 elements of a valid consent? It must relate to a treatment, must be given voluntarily, must be explained by the physician, must be signed and witnessed, must not have been obtained through misrepresentation or fraud, must be informed. Let's see what you know, Trudy.
I think the 4 elements of a valid consent is it must be related to treatment, it must be given voluntarily, it must not have been obtained through misrepresentation or fraud, and it must be informed. Jehanera, name the 6 required elements of informed consent. So which 6 of these are they? Nature of treatment, alternate courses of action, who is administering the treatment, cost of the treatment, material risks of treatment, likely consequences of not receiving treatment, expected benefits of treatment, or material side effects of the treatment.
The correct answer is nature of treatment, alternative courses of action, material risks of treatment, likely consequences of not receiving treatment, expected benefits of treatment, material side effects of the treatment. So Trudy, what is the name of the law that governs Substitute Decision Making Act in Ontario?
The list looks similar to the last one around healthcare consent, but in in relation to substitute decision making, it's the Substitute Decision Making Act.
Good job.
A person is considered mentally capable of providing informed consent when, so choose two of the following. They are able to understand the information, they have a mini mental score of greater than 18, they can appreciate the consequences of the decision, they are between the ages of 18 and 65 years of age, they have no known history of cognitive impairment or psychiatric disorders.
A person is considered mentally capable when they are able to understand the information and they can appreciate the consequences of the decision they make. List the hierarchy of the SDMs in the Healthcare Consent Act from highest to lowest ranked persons. What do you think, Judy? Would it be your parent or your child who will be making decision if you are incapable?
Actually, this next slide shows the hierarchy in order. So top would be the guardian, a person with authority for treatment. Next would be the attorney named in power of attorney for personal care. Third would be the representative appointed by consent and capacity board. Fourth would be spouse or partner. And fifth, here's the answer to your question. Actually, my child or my parent would have equal authority according to the hierarchy of substitute decision making. Sixth would be parent with right of access only. 7, brother or sister. 8, any other relative by blood, marriage, or adoption. And 9, office of the public guardian and trustee. So the objectives, I hope everybody was able to answer some of those questions, and we will reinforce some of those answers further on in the slides. So the objectives of this session is to increase the knowledge of and skills in applying the Healthcare Consent Act and the Substitute Decision Making Act in relation to advanced care planning specific to Ontario, and also to increase your awareness of resources available for yourselves and your patients in relation to advanced care planning. So just to get an idea, we'll start with what's the current state in relation to healthcare consent and advanced care planning, and it will show you why we are doing this session. So there's an overall lack of common language and understanding of the Healthcare Consent Act in Ontario, and as well as advanced care in relation to advanced care planning. There's resources and tools being used in Ontario that are non-compliant with this act. There's a high level of misunderstanding regarding the relationship between the healthcare consent and advanced care planning. And really the major concern is that many healthcare professionals, as well as the general public, are not following Ontario-specific law as it pertains to healthcare consent and advanced care planning.
So let's discuss what is actually advanced care planning. It is a conversation about wishes, values, and beliefs, a discussion with a mentally capable person and their substitute decision maker, SDM. Sharing this information helps the SDM make decision on behalf of the person if they were mentally incapable of making the decision required. It helps them identify the wishes or the person's SDM either through the SDM hierarchy or through the power of attorney for personal care selection. It is a voluntary process that could be conveyed in any form, that is, your wishes shared orally, written, or alternative means of communication. So the requirements for SDM is they should be willing to act as your SDM, they should be mentally capable to make the needed health decisions for you, they should be available, that is in person, by phone, or by some other means when a decision needs to be made. They are not prohibited by court order from acting as your substitute decision maker, and they're at least 16 years of age.
Next, what we're asking is, what is healthcare consent? It's informed decisions about personal and health care, which could include admission to long-term care. It is a consent obtained by the healthcare professional from either a mentally capable person or a substitute decision maker if the patient is not, or person is not mentally capable. It is also capacity is determined by the healthcare professional and may be decision specific since the capacity can fluctuate. Consent may also include a plan of care or goals of care related to the current health condition, and that's the key there, is the current health condition. Some of the commonly misused words, what you will find, include advanced directive, or living will, and these are not Ontario terminology nor used within the law. These terms should not be used in any policies, conversations, and documents. Next of kin is another common misused word. Many forms refer to patient's next of kin or POA rather than the patient's substitute decision maker if he or she should become incapable for making decisions regarding treatment. And then the other is around the hierarchy of substitute decision making. It's important that a patient understands who will be his or her substitute decision maker for healthcare or personal care if he or she becomes mentally incapable to make health decisions. Every patient automatically has a person who has legal authority to act as a substitute decision maker if they are capable, but it's important for them to know who that person is.
So the truth about the misconception is that advanced care planning wishes are not informed consent. Informed consent is about a treatment, a specific treatment, or a specific procedure. Advanced care planning is also not a plan or a decision regarding anything. It's just the wishes that are being known or are being vocalized. Advanced care planning is not just about end of life. It's about any healthcare decision or any wishes regarding the healthcare decisions and healthcare treatment plan. You do not need to document your advanced care planning wishes. Forms such as advanced directives, living wills, goals of care for future treatment plans which are beyond person's current health and level of care forms are not legal in Ontario. We will discuss about in differentiation about these things in our slides ahead. You do not need to choose your substitute decision maker. Next of kin is not a valid substitute decision maker, and advanced care planning should not be associated with physician-assisted dying.
So why talk about this?
Because we live in Ontario and it's the law. There is tremendous confusion and incorrect practices within hospitals, long-term care homes, community health service programs across Ontario. There are many healthcare organizations across the province are currently non-compliant with the Ontario legal framework. They use some terms which are not acceptable. They, in their formal documentation, for example, they use next of kin rather than who would be substitute decision maker. The Law Commissions of Ontario strongly recommends the use of terminology in Healthcare Consent Act.
And here's a direct quote from a document around healthcare consent and advanced care planning noted by the Law Commission of Ontario. And it states, we recommend that terminology used in healthcare consent and advanced care planning, forms, tools, and policies track the language in the Healthcare Consent Act, and that these documents should expressly distinguish the difference between consent and the recording of wishes, values, and beliefs. So why do we need to get this right? Outcome evidence indicates that advanced care planning improves patient and family satisfaction with end-of-life care and in care in general. It decreases caregivers' distress and trauma. So if there's discussions ahead of time about general wishes, values, and beliefs, caregivers, once they need to start making decisions for patients, if they're not capable, feel less anxious about that they are making decisions per the patient's wishes. Decreased unwanted investigations, interventions, and treatments. There's an increased likelihood of dying in a preferred setting if those discussions are held in advance. There's decreased hospitalizations, emerge visits, and admissions to critical care, and it ultimately decreases the cost to the healthcare system and improves patient and family satisfaction. So why does this matter to get this right? Various government reports and documents have shown evidence around this, including the advanced high-quality, high-value palliative care in Ontario through the Declaration of Partnership and Commitment to Action in 2011, a recent Auditor General's report in 2014 around preferred places of death, acknowledging and supporting patients' wishes, values, and beliefs, the patient's first action plan in the recent report in November, December of 2015, and the Canadian Cancer Society report around hospice palliative care, right to care, as well as the March 2016 palliative or the Fraser report. And all of these documents will lead to improved, or hopefully transform the healthcare system and improve quality of care for all Ontarians. The other document or note here is a slide shows the relationship between the healthcare consent and advanced care planning. So again, the overall focus is around the person's values, wishes, beliefs, and goals of care. And in relation to future advanced care planning, you're having conversations around future care and wishes in the future. Goals of care and decision making or consent discussions are more specific to current care and specific to treatment decisions being made. So you can see the relationship on how these can influence each other. If those conversations are had, ahead of time, it can help help patients and families make decisions around current care needs. And often at these times it's more of a crisis or a stressful situation, so it helps to have some advanced discussions around the care.
So Trudy, let's clarify the differences between advanced care planning, goals of care, and treatment decisions. So advanced care planning actually happens in the context of future healthcare treatment, or it implies in future. The outcome is substitute decision maker is identified and prepared for future decision making, and outcome is not the code status. And goals are identified by the patients and they are described by the patients. Goal of care discussion actually happens about a current situation or current condition. Outcome is different every time. Exploring patient's goal and assesses readiness and prepares for decision making. Outcome is not code status. And patient is the one who defines and describes the goal of care. Decision-making or consent discussion also happens in the current context. Outcome is always care or treatment decision. For example, what is the code status? What would be the treatment plan, etc. And the goals are defined according to the medical needs. For example, cure, resuscitative, or comfort for the patient.
That makes it a little bit clearer. So Jahan, what is the role of the healthcare provider?
Well, it's legal and ethical duty to obtain informed consent for every treatment or care option being offered. Healthcare professionals are also responsible for determining whether the person is mentally capable to consent or treatment or care option. Tell me, Trudy, if they are not capable, who would make the decision?
Would be the substitute decision maker.
Correct. So healthcare providers are responsible for determining substitute decision maker requirement, and also to find out if person is deemed mentally incapable. Provider must seek informed consent from the substitute decision makers if person is deemed incapable. In a true emergency, if person is mentally incapable to provide consent, providers need not obtain consent but must follow person's known wishes in respect to treatment or care. So what do you say, Trudy? Is it the only time when...
That would be the only time a healthcare professional can provide a treatment in an emergency basis. They would make every effort to reach the SDM if the patient is not capable. However, it's not going to prevent from care being provided.
Great, thank you, Trudy. So who is advanced care planning for?
Advanced care planning is really for everyone, not just about end-of-life care. It involves, it's an engaging process, or engaging in the process of advanced care planning is an opportunity for all mentally capable adults to share what's important to them for future health and personal care wishes. And there's many opportunities to do that, with your family or friends, and particularly your substitute decision making. When an event happens, you hear something happening on the news, and someone may comment, "I wouldn't want that for myself." So there's an opportunity for a discussion, and it's not only a one-time discussion. The link to end of life only contributes to perpetuating the misconceptions. So if we can encourage all to engage in the expression of what's important for them in future health and personal care decisions, this will speak to the broader intent of the legal framework in Ontario and is an excellent opportunity to make these conversations normal and part of what we should all consider. It's important to recognize that people at end of life are not advanced care planning, but at that time they are indicating a consent to treat or plan of treatment based on the current context.
So Trudy, when you say we should encourage all to engage in the expression of what is important, do you think it includes us too?
Yep, includes you and me as well.
Good. So what are the opportunities for improvement? It clears confusion and dispels misconceptions. It promotes knowledge about the legal framework in Ontario. Discussing advanced care planning encourages consistent practices among the healthcare providers. Using the accurate language to promote clear communication. Discover Ontario's specific tools, supports, and resources. And these tools and supports could be paper and people. So Trudy, you let us know what other resources are available in Ontario.
This slide shows an Ontario Power of Attorney kit, so it's not something that you need to purchase or necessarily go to a lawyer depending on the complexity of your wishes or your needs relating to personal care. This booklet contains both a continuing power of attorney for property and a power of attorney for personal care. It can be downloaded from the internet, or as healthcare providers, we can also order these books in copies of 50 at a time to help support our patients and families to do advanced care planning. Through Hospice Palliative Care of Ontario, the Healthcare Consent Advanced Care Planning Community of Practice, they are available to help in response to the need for provincial resources on healthcare consent as well as advanced care planning that utilizes the Ontario legal framework. The community of practice was created to support clinicians, administrators, caregivers, policy makers, researchers, educators, and leaders who are committed to the promotion of healthcare consent and advanced care planning in Ontario. The leadership advisory team is comprised of a diverse group of experts in the legal, policy, clinical, operational, knowledge, translation, and implementation of healthcare consent and advanced care planning in Ontario. Also, there are regional champions, of which I am in the Central West area, is comprised of 1 to 2 leads from each LHIN area that have a primary role in promoting and implementing healthcare consent and advanced care planning within their geography. And then the board membership is also comprised of anyone interested in coming together to better understand and promote healthcare consent and advanced care planning in Ontario and encourage the recommended Ontario tools and resources to build capacity and awareness. And later on there will be a slide where everybody, all healthcare professionals, can become part of that community of practice to support healthcare consent and advanced care planning in Ontario. So Hospice Palliative Care, the Care Ontario Healthcare Consent Advanced Care Planning Community of Practice Resource Review has spent a considerable amount of time across the province and effort to review organizations and associations, documents and processes, and to ensure that they comply with the Ontario legal framework. The resource review process emerged out of a strong desire to support each other, colleagues, and address the specific nature of healthcare consent and advanced care planning in Ontario. You can yourself, as an organization or individually, have a formal review of your resources and documents by contacting Julie Durnay at Hospice Palliative Care Ontario. So what we have done is put together some of the resources available that have been vetted through the Hospice Palliative Care community of practice around advanced care planning and healthcare consent. These tools include healthcare consent, advanced care planning common themes and errors, leadership in advanced care planning, planning in Ontario tool, leadership screening tool, healthcare consent and advanced care planning glossary of terms for Ontario, information around physician-assisted dying and advanced care planning, and then the National Consent Legislation Summary Chart, and then ACE, they are the Advocacy Centre for the Elderly in Ontario, have also put some tip sheets together that are available through their website and through Hospice Palliative Care Ontario.
And these slides are also one of the initiatives from Health Care Consent and Advanced Care Planning community of practice. So I would like to thank them again for that. So one of the other resources is Speak Up Ontario. It's a website, speakupontario.ca, and it has a workbook, and it allows patients and families to use that workbook in order to initiate and generate discussion. So when you go, I'm just demonstrating right now how to get on the website. When you go to the website, it's just lets you download advanced care planning workbook, and then once you download it, it lets you complete either on computer or either and once if you complete it on the computer, it will email you the whole workbook that you have done. And if you don't want to do it on computer, you can also print it and work with the families, patients, or even for your immediate family, for yourself as well. So it's a good guide to walk you through the advanced care planning, and it lets your wishes to be known to whoever you want them to be known to.
And it's nice if you do it online, you don't have to complete the whole workbook. It allows you to log in and you can continue working on it or make changes to your plan.
Let's get back to our slides. So other healthcare consent and advanced care planning Ontario specific resources are listed here. These are Hospice Palliative Care Ontario website, Ontario Healthcare Consent Act, Ontario Substitute Decision Act, Consent and Capacity Board, Public Guardian and Trustee Office, sorry, come again, Trudy, what was it?
It's Advocacy Center for the Elderly.
Yeah, it's there. So these websites, you can log in, you can just go get whatever information you need, also approach people from there if you need to. So these are the good list, a comprehensive list of resources as well.
And all these resources have been vetted through the community of practice around healthcare consent and advanced care planning. So the benefits, along with ensuring the right information is given to the right person at the right time, the resource review process can help ensure materials and knowledge complies with Ontario law, facilitates the use of accurate, consistent, and clear information throughout Ontario, can correct misunderstandings and misconceptions, and provide suggestions to enhance clarity and understanding, meet the legislative professional obligations for all healthcare professionals of any type and at any regulated healthcare facilities, whether you're in hospital, long-term care, or in the community. It also honors the basic rights of patients and residents' rights in long-term care homes acts and reduces the risk of complaints and legal liabilities.
So we in Ontario need to get this right. because consent and advanced care planning is relevant to 100% of the Ontarians. We just discussed what it is. Now we have more knowledge. We have lots of resources in order to work with patients, family. Therefore, it is not a matter of if we get this right. It is now about how and when we get this right. It is also a matter of when, not if, system performance indicators are implemented at regional level. It is also a matter of when and not if this will be added to accreditation standards. Regardless of accreditation standards, this should be part of our practice so that in the end we reduce the chances of crisis with patient situations and family distress. Effectiveness requires a system-wide approach and ideally a coordinated effort at provincial, regional, community, and organization levels is required for it to be successful.
So if you want to get involved with the Hospice Palliative Care of Ontario Healthcare Consent Advanced Care Planning Community of Practice, you're welcome to join. It's open to clinicians, administrators, caregivers, policymakers, researchers, educators, and leaders from any sector who are committed to the promotion of healthcare consent and advanced care planning in Ontario. So here's the link for this, and you'll be able to link to the survey and add your name to become involved.
So in this webinar, we discussed what is advanced care planning, what is healthcare consent. We also listed some of the difference between healthcare consent and advanced care planning. We also looked at the SDM requirements and also the hierarchy of substitute decision maker. We also now are knowledgeable about some of the commonly misused word, and we know the truth about the misconceptions. We also know what healthcare professionals can do and why we need to get this right and what are the advantages of it being discussed with patients. We were also able to clarify the differences between advanced care planning, goal of care, and treatment decisions so that we do everything correctly. And in order to prevent any crisis, we need to do some things in advance and something we have to do at the time of treatments to reduce anxiety among patients and family members. We were also able to look at some of the resources and the list of the resources, and please feel free to use these resources as well as use these slides in order to educate your colleagues, your community partners, patients, families, other healthcare providers in your organizations, in your community of practices, everywhere. The more we spread the more words, the more we get the right advanced care planning and more we reduce the crisis in the end. So here are the references we used for these presentation, and feel free to use it for yourself as well.
And we'd like to thank everyone for listening in on this health promotion session on the Healthcare Consent Act and Advanced Care Planning. We'd like to thank Hospice Palliative Care Ontario Community of Practice around healthcare consent and advanced care planning for providing the slides and their input into this session, as well as we would like to thank the Community Health Nurses Interest Group of RNA ODE for putting this webinar together for us. Thank you. If you have any questions that you want to ask us specifically, here are the contact information for myself and Jahanera. And feel free to send us an email, and we will attempt to answer your questions or direct you to the resource information. Thank you again.
Thank you so much.
Great. Thank you so much, Trudy and Jehanera, for providing us with this very informative presentation on how to apply Healthcare Consent Act and the Substitute Decision Making Act in relation to advanced care planning specific to Ontario, and for providing us with such great resources to be able to access in relation to advanced care planning. Thank you.
Thank you, Angela.
Thank you.